This project is supported by the Administration for Community Living, ACL, U.S. Department of Health and Human Services, HHS, as part of a financial assistance award with 100% funding by the agencies. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by, ACL, HHS, or the U.S. government.
Hello and welcome to Ask SMP. I'm Danae, your Community Outreach Specialist in Mississippi.
And I'm Johnetta, Complex Issues Specialist for the Senior Medicare Patrol Program in Georgia, Louisiana, Mississippi, and Vermont.
Each month, we take a question from a beneficiary and break it down so you can learn how to protect, detect, and report Medicare fraud, errors, and abuse.
This month's question comes from Pam, who writes,
Medicare Open Enrollment starts October 15th and runs through December 7th each year. I've been getting a lot of calls offering incentives to switch coverage. Some even sound like they're from familiar insurance sources. It's so confusing. Should I be aware of any possible issues before engaging with a caller?
That is a timely question from Pam. Open enrollment is the period when Medicare beneficiaries can review their current coverage and make changes, like switching from original Medicare to a Medicare Advantage plan or changing Part D drug coverage.
But unfortunately, this time of year also brings an increase in fraudulent activity. Scammers know beneficiaries are comparing plans, and they see an opportunity to steal personal information or push fake insurance products.
One of the biggest scams involves phony phone calls. Scammers pretend to be from Medicare or a government agency and try to trick you into giving up personal details like your Medicare number, Social Security number, or bank information.
That's right. These callers often use spoofed caller IDs that look official, sometimes even showing Medicare or a government number on your phone. They may say you're owed a refund or that your coverage will be canceled if you don't act fast. Remember, Medicare will never call you to sell a plan or ask for your information.
Another red flag, someone offering rebates or cash back for switching plans. This is a fake refund scam where they tell you you're owed money for your prescription drug coverage or lower plan costs. The catch? They'll ask for your Medicare or bank info so they can deposit the refund, which is really just a way to steal your identity.
Scammers also mail out counterfeit brochures or sales materials that look legitimate. They're designed to get you to call in and enroll, so the scammers can gather your personal or payment information.
And let's talk about high-pressure sales tactics. You might get a call saying, you must pick a new Part D plan or your benefits will terminate. That's false. Prescription drug plans and supplemental insurance, sometimes called Medigap, are optional.
Exactly. Real agents and brokers who sell legitimate plans must follow strict rules from the Centers for Medicare and Medicaid Services. They can't threaten you, promise gifts, or pretend to be Medicare.
Here are a few ways to stay safe this open enrollment season. Never share your Medicare or Social Security number over the phone. Don't respond to unsolicited calls, texts, or door-to-door visits about Medicare. Be cautious of offers that sound too good to be true. If you receive mail or emails about new Medicare products, verify directly with Medicare by calling 1-800-MEDICARE or visiting medicare.gov.
Real agents and brokers who sell legitimate plans must follow strict rules from the Centers for Medicare and Medicaid Services. They can't threaten you, promise gifts, or pretend to be Medicare.
Here are a few ways to stay safe this open enrollment season. Never share your Medicare or Social Security number over the phone. Don't respond to unsolicited calls, texts, or door-to-door visits about Medicare. Be cautious of offers that sound too good to be true. If you receive mail or emails about new Medicare products, verify directly with Medicare by calling 1-800-MEDICARE or visiting medicare.gov.
If you need help comparing plans, use the Medicare Plan Finder tool at medicare.gov or contact your state health insurance assistance program SHIP for free, unbiased counseling. SHIP counselors can help you review your options safely.
If you suspect an open enrollment scam or receive a suspicious call, hang up and report it.
You can contact the Senior Medicare Patrol at 1-877-272-8720, or you can report fraud on our website, www.stopmedicarefraud.org. We're here to help you verify, protect, and report.
Remember, open enrollment is about finding the right coverage for you, not rushing into a decision because of pressure or fear.
Take your time, verify information through trusted sources, and never share personal details with anyone who contacts you unexpectedly.
And if it sounds too good to be true, it probably is. Thanks for joining us on this episode of Ask SMP. Stay alert, stay informed, and we'll see you next time.
Take care and protect your Medicare.